It is a very good question. To find out the answer, we need to understand what is happening now. Literature shows that when a rural patient has surgery, 40% go below the poverty line because they either have to sell their income generating assets or borrow at a very heavy interest. It is not just the money they pay to the hospital. The loss of time, money and time spent by the relatives, etc. add to the cost. Minimal invasive surgeries have the advantage that the patients can get back to work within days, and the time spent at the hospital is also very little. However, they are not easily available, and even if available at present, it is way beyond the reach of the poor. The expensive equipment, the need for expensive medicines and specialists for general anesthesia, the need for bottled gases and delicate unfamiliar instruments, etc. makes MIS very expensive.
Everyone knows that modern surgery is not available to rural areas. There are plenty of reasons why it's not available. I'm not going to go into the reasons for it, but I'm going to talk about innovations which will help us take these modern surgeries to the rural areas.
The most important factor in making MIS available in rural areas is the need for the capability of doing them under easily available and less expensive spinal anesthesia. The quick turnover of patients means that these surgeries are possible by surgical teams visiting rural areas.
Our innovation does away with the gases because surgeries are possible under spinal anesthesia. This will make them available to any remote corner of our country. We have operated on patients in remote areas in Mizoram, Nagaland and Arunachal Pradesh, where it takes us almost 10 to 15 hours to travel to those places.
Seesha has been able to do 750 gasless laparoscopic surgeries and over 2,000 endoscopic surgeries.
Diagnostic and surgical camps. We are making healthcare accessible even to those living in the most remote rural and tribal regions of South and Northeast India. We also carry out research in order to develop cost-effective and innovative treatment methods so that healthcare is also affordable to the poor.